Welcome to Across Africa, our weekly look at stories from across the continent. I'm Georgia Calvin-Smith, and this week, an historic investment in the country's well-being or a mistimed election gamble, a new law laying the groundwork for the introduction of universal healthcare in South Africa both excites and divides. Also, EdTech has the potential to close education gaps in DR Congo. The Africa Tick digital learning portal's going down well with kids who've been using it so far, but founders of the startup struggle to attract the investment they need to scale up their impact. And Tunisian boxer Khouloud Al-Halimi is hoping to hit the Paris Olympics hard as she battles her way towards the Games. She's not only going for gold, but wrestling her way into the history books as the first Tunisian woman to medal is also one of her goals. But first, South Africa has moved a step closer to bringing in universal healthcare. After years of debate and consultation, President Cyril Ramaphosa signed in a new law establishing a fund to provide healthcare to everyone. It could take years to put the system in place. And despite the lofty goals, critics do say that the plan is flawed and that South Africa can't currently afford the change. Ramaphosa, though, is sure that it is an important step in tackling rampant inequality. Take a look.
It's a bill that's been 12 years in the making and that could revolutionize the South African healthcare system.
It is a good thing because it will help poor people to get the good care of the healthcare.
In one of the world's most unequal societies, universal healthcare could save millions of lives.
If it does happen and it's successful and monies are managed properly and you're actually getting better health care to all those people in rural areas and those people even in our urban areas that don't have access, then I think it's okay.
Up until now, the country's healthcare was based on the private and public systems working in tandem. Up to 80% of the population relies on the public system for their care, although it's dramatically underfunded and understaffed. The legislation will gradually limit the role of private insurance, create a new public fund to provide free access for South African citizens, and cap the fees private doctors can charge to patients. But some are sceptical. They've been disappointed by the public sector before.
If you look at all of our state-run enterprises, they just don't work. I think there's too much corruption within the ANC. If we look at the history of the ANC and the SAA, ESCOM, it won't work.
Given the country's low economic growth, the opposition fears the bill could cause the already overburdened public health system to collapse.
Democratic Alliance will, upon its signing into law by Cyril Ramaphosa, challenge the ANC's NHI all the way to the Constitutional Court and will file our legal challenge against this devastating legislation without delay.
The bill, which should be implemented in stages at a cost of billions of euros, is expected to be a major talking point in the country's upcoming elections on May 29th.
Well, Congolese tech startups hoping to get more kids excited about school have started rolling out apps that help take creative learning online. The Africa Tick software has taken off in dozens of schools already, but it will take investment to scale this impressive start up. And it's still proving difficult to tempt investors away from the extractives industry and towards EdTech.
In this classroom in Kinshasa's Matonge district, a digital screen has replaced the traditional blackboard, and the pupils work on tablets. Once a week, the students use a set of specialized apps to learn and revise core subjects such as maths and geography.
Teaching is play. In the DR Congo, it's recommended that teaching should be concrete. What you teach, the child sees, he touches, and remembers. For us, it's really great.
The approach appears to work, and it's winning pupils over too. Children can learn to count through the applications using intuitive methods, such as buying items at a market represented on a tablet screen.
The learner finds themselves in scenes they're used to, and at the same time they can switch to the language in which they have the best command, which could be French in the DRC, Chiluba, Swahili, Lingala, Kikongo, which are national languages, and we recently added English.
80 schools across the country are using the Africa Tick applications, and the startup wants to scale up the distribution and use of the software. The team is hoping to attract more investment during the entrepreneurial scramble for funding of Kinshasa's French Week. Michel is also hoping to win backing for his project, which trains nursery school teachers for free.
It's a principle. Give me a good economy, I'll give you a good education. Without funding, it's not possible, hence our cry of alarm. If we fund childhood education, we'd have fewer problems because children would have been trained from the start.
Education is underfunded in Congo, comprising 13% of the state budget. These education entrepreneurs are hoping to plug the gap with money from foreign investors, who for years have focused almost solely on the mining and energy sectors.
Malaria is one of the leading causes of infant mortality in Africa. Ghana, Kenya and Malawi have been piloting the RTS malaria vaccine for 3 years. Since 2019, more than 2 million children have been vaccinated across the three. Our Justice Boydu tells us more.
It's vaccination day at the St. Joseph Hospital. This health center is just on the outskirts of Accra. And for those gathered here, nearly everyone knows someone who has died from malaria in the past.
Malaria happens to be one of our top 10 priority cases as far as OPD is concerned. Before the introduction, the mothers show some hesitancy. But as time goes on, now everybody wants the child to take the vaccine.
Martha Obeng is one of the women who has brought her son to take the new anti-malaria vaccine. The Gumwa East municipality, where this hospital is located, is one of 93 in Ghana where this vaccine is administered.
My place is very bushy, and our problem is the mosquitoes. I have 3 children, and Danny is my last born. He has received 2 vaccines, malaria vaccine, and he is strong and very healthy. My first 2 children, they are dull. They are not strong like Danny.
The rollout faced an initial challenge of hesitation, especially among some religious groups, and anti-vaccine propaganda, largely on social media.
There has been a significant reduction in all-cause mortality and all-cause mortality in death among these children from all causes, of which obviously malaria will be inclusive because that is the #1 contributor in most of our countries of deaths in children under 5.
The country wants to extend the vaccine to cover all of its districts by 2025, but a lot of it depends on the availability of funds to buy them and the capacity of companies to produce the numbers needed.
The water crisis in the coastal city of Durban in South Africa continues to take its toll on the ruling ANC's chances in the upcoming vote. It's the first time since 1994 the party is expected to drop below 50%, and months of shortages have ramped up frustration with the status quo. Laurent Berchecker with more.
Hidden behind breathtaking beaches and subtropical climate, a crisis is looming in the South African city of Durban. For months, residents like Rani Naidu have seen their taps run dry on a daily basis.
You see, we don't have any water. We cannot do anything, and it's really...
The shortages have placed a physical and financial burden on local populations who are forced to purchase bottled water and to carry it over long distances. Hoping to tackle the crisis, local groups recently began distributing water to disenfranchised communities, but their efforts are far from enough.
It is better, dilute our water and give us cyanide in it and let us die immediately, because this is a slow death.
Many are blaming the ruling ANC party for the crisis and accuse it of failing to address Durban's crumbling infrastructure.
Our president himself is not even helping us anymore, so I'm very, very disappointed with the whole situation in South Africa.
And with the country heading into a general election on May 29th, opposition parties are trying to capitalize on the growing dissatisfaction in KwaZulu-Natal province.
The stakes are high for the ANC, but this time around it's even worse because almost all political parties have vested interest in what is happening in KwaZulu-Natal in general, and they are promising that if they were to win, they would do things better.
Durban's ANC mayor recently announced plans to build a new dam in order to solve the water crisis, but it may be too little too late for the city's disgruntled voters.
Tunisian boxer Khouloud Al-Halimi is giving it her all as she trains to hit the ring hard on arrival here in Paris for the upcoming Olympics. She's going for gold at her second time in the ring at the Games. Clem Valla tells us more.
With an iron fist and unbreakable determination, Tunisian boxer Khouloud Al Halimi is not pulling any punches as she prepares for Paris 2024. Dancing across the ring, she is not afraid to trade blows with her opponent. The 34-year-old has one goal: become the first Tunisian woman to win an Olympic medal in boxing.
The Olympic Games represent a culmination of my career, encompassing all my training and efforts. Being nominated for the Olympics means standing out, if you are an Olympic athlete or not, and the most important thing is representing your country.
Over her 18-year career, Al Halimi has secured several titles in the flyweight and super flyweight categories, including the 2024 Nelson Mandela Africa Cup, the 2023 African Championship, and the 2019 African Games. Now, with Al Halimi's second Olympic qualification secured, Tunisia's hopes for Olympic glory in boxing rest on her shoulders.
You know that boxing in Tunisia hasn't had a medal since 1996, an Olympic medal. I hope that it'll be by my hand, God willing, just to make Tunisia, all Tunisian people and all Arabs happy.
Women's boxing in Tunisia does not receive much attention from authorities or support from fans and clubs. However, despite facing criticisms and doubts about her stature in the sport, Al Halimi has the National Federation in her corner.
Khouloud's nomination is a historic achievement. She is truly the pride of Tunisian boxing, and women's boxing especially.
Al Halimi hopes that Paris 2024 will see her name engraved in gold, affirming her excellence in a sport traditionally dominated by men.
Looking good. Well, that, though, is all we have time for Across Africa. Thanks very much for joining us, and do so again if you can. Till then, take care.
Special event.
Hello from the Cannes Film Festival. Some of the big names expected this year include Emma Stone, Kevin Costner, Richard Gere and Demi Moore. Join me every day from Cannes for everything you need to know from the most exciting and glamorous film festival in the world.
Arts 24 in Cannes on France 24 and France24.com.